Good day everyone, this is Krisha, and today, with regard to World Tuberculosis Day, we are going to have a conversation. World TB Day is celebrated on 24th March every year. Started in 1882 by Dr. Robert Koch, it revolves a different theme every year. And this year, the theme being, Invest to End TB, Save Lives. And on account of this day, we have today Dr. Ramanathan, Senior Consultant Pulmonologist and Lung Transplant Physician and the Director of KMCH Center for Advanced Lung Diseases and Lung Transplantation with us today. Good morning, sir.
Good morning, Trisha. Thank you.
Sir has completed his MBBS from the PSG Institute of Medical Sciences and Research. He has received several gold medals there for being the university topper in the examinations and has received the GV Memorial Gold Medal for being the best outgoing student. Sir has completed his MD in Pediatrics at the Seth KM School for Postgraduate Medicine in Gujarat. There as well, he received the IAP Gold Medal for being the topper in university examinations. Later, Dr. Ramanathan went to pursue his DM in Pulmonary and Critical Care Medicine and also did a 3-year super specialty course in Adult Pulmonary and Critical Care Medicine. Sir has taken up a clinical fellowship in lung transplantation from the Toronto General Hospital in the University of Toronto and a full-time clinical fellowship in adult lung transplantation. The world's first successful lung transplantation was performed in this center, and it is one of the few busiest centers in the world. Sir's professional experience has been truly vast, wide, and rich. He has headed the Department of Pulmonary and Respiratory Intensive Care Unit. He was the Associate Professor and Head in the Department of Pulmonary, Sleep and Critical Care Medicine and the Director for Lung Transplant Program at the PSG Institute of Medical Sciences and Research. Since the year 2019, Sir has been associated with KMCH. Sir's special areas of interest include lung transplantation, advanced lung disease evaluation and care, chronic respiratory failure care, home oxygen and home ventilation, sleep and respiratory failure, pulmonary rehabilitation, and pediatric advanced and complex lung diseases. Sir has several awards and recognitions to his credit, some of them being the Fellow of American College of Chest Physicians, American Academy of Sleep Medicine, Fellowship for the International Scholars, ERS Fellowship for training interventional bronchoscopy at St. Margaret Hospital in France, and the Vocational Excellence Award by the Coimbatore Rotary, Manchester. Sir also has a long list of research and publications to his credit. To such a towering personality, I extend a warm welcome. We welcome you, sir.
Thank you, Trisha, for kind words.
Can we start with the question?
Yeah, please go ahead.
So, common knowledge tells that TB is a disease that's caused by a bacteria called Mycobacterium tuberculosis, and it usually infects the lungs. So, how does one know that they have this disease, sir? What are the common signs and symptoms that they are most likely to display?
Yeah, as you rightly said, Mycobacterium tuberculosis is a bacteria, and it affects many organs of our body. The most commonly affected organ which is affected by Mycobacterium tuberculosis is lung. So most of the time when you want to know about what are the manifestations, how a patient of tuberculosis present, and we always we understand we are talking about lung tuberculosis. Medical term is called pulmonary tuberculosis. And this disease is little different from other bacterial disease of the body because it has a very gradual onset in its manifestations. And the symptoms are very mild and subtle. So that's why usually most of the time the patients of tuberculosis, they are not diagnosed early. And the presentation, it can be a generalized symptoms, like they have it does not point to any parts of the body, like we call generalized or non-specific symptoms. And they will have symptoms of the affected organs also, although the most commonly affected organ is lungs. So the generalized symptoms are basically fever. Then some of them will say even feverishness. They will have a low grade temperature in the evenings. and we call evening rise of temperature. And some of them will feel malaise, like tiredness. They will keep telling that I am tired of late, and they will have reduced appetite. They don't feel like eating. They may have appetite, but they don't feel like eating it, and associated with weight loss. So these are the generalized symptoms: tiredness, fever, and weight loss. And when along with this, if they have they are also likely to have, especially for lung tuberculosis, they'll have cough. And it's not like you can have cough after a common cold also. But most of the time that cough is self-limited. Usually it'll go in 3-4 days, 5 days, it'll disappear. In tuberculosis of the lung, when the tuberculosis affects the lung, they'll have a prolonged cough. When I say prolonged, it is any cough which lasts for more than a couple of weeks, more than 2 weeks, we need to think of. Although there are other conditions which can present with cough for more than 2 weeks, like even asthma can have, but in combination of this fever, loss of appetite and weight loss, they have a cough for more than 2 weeks. That is only important, and that is a very pointer that the patient may have, especially in a country like India, where tuberculosis is very prevalent, and we call chronic cough, or a long-standing or a prolonged cough. This cough can be dry, or it can be with the phlegm. And one more very attention-seeking is blood in the sputum. We call medical term hemoptysis, but for a patient we call blood in the spitting blood, and usually associated with the sputum. And some of them we can have chest pain. So it is important to know tuberculosis involving the lung, because it has a lot of implications. It can spread. Lung tuberculosis, it is contagious. So we need to know what are the manifestations. As you rightly asked this question, how do we know that we have a tuberculosis of our body, especially lung tuberculosis? The generalized way, non-specific symptoms in combination with respiratory symptoms like cough and sputum or blood in the sputum, with or without chest pain.
Yes, sir. So do people usually shrug it off when they have a common cold or fever? And when they come, is it too late sometimes, sir?
Yeah, because as I told, no, this because it's a very subtle symptoms, gradual onset. They come very late. By the time the organism will be spreading more in the organ, and a large area of lung will be affected.
Yes.
So that's why some of them will say, I'm okay with the paracetamol, with something. They keep going. Yes. In the busy world, they are focused on their work. Children, especially college school students or college girls, during exam times, they prepare without eating, having good food or adequate sleep. They develop tuberculosis, and the parents don't realize that the child is having manifestation of tuberculosis. And when they come to us, they have a large portion of the lung is affected, and it leaves a lot of scar in the lung, which is not good. Yes. So it is very, very important you pick up tuberculosis early, and once a responsibility is the patient's awareness among the people that when somebody has a cough for more than 2 weeks, especially with weight loss and appetite loss, we should seek medical help.
Yes, sir. I'll make sure to remember.
So that we pick up early. Two advantages of picking up early in tuberculosis. One is you as a person, the affected patients benefit,
yes,
and the society also benefits, because by the time, many times you diagnose tuberculosis, they would have given this disease to many people.
Yes.
So it is contagious. So early diagnosis is very important, and that's what the tuberculosis program of the world, they want to pick up tuberculosis early.
Yes.
Especially lung tuberculosis.
Yes.
We can have tuberculosis other parts of the body. For example, bone TB or skin TB. They are not that contagious like
the lung TB. Yes. So I've also learned that not everybody who gets this bacteria ends up with the disease. And as a result, there are two types: latent TB infection and the TB disease itself. So what are the common differences between these two, sir?
Yeah, good. Very nice question. So that your understanding of tuberculosis is good. So basically, as I told, tuberculosis is a contagious disease, and it spreads from an affected patient to another person through air.
Yes.
And the affected patients from the lung, when they cough out or they spit or they even shout loud, yes, the respiratory tract secretions, they are broken into small droplets, and in the center of the droplet we call nuclei. We have numerous Mycobacterium tubercle bacilli, and they live in the air suspended, and when somebody else who's in the close proximity for prolonged period, like household contact, if mother develops frank lung TB, the child who's living with the mother or a husband develops, or the wife or the spouse, frequently they're exposed, and they are exposed to this organism in the air, and they inhale. So Mycobacterium tuberculosis enters through lung. The inhale, the route of entry into our body is through the respiratory tract. When they enter into our respiratory tract, our lung has a God-given first line defense. The soldiers, not only for the tuberculosis, any bacteria or any foreign body, we have n number of protective mechanisms. Starting from the nose, we have a nasal hair, which will prevent the large particles entering into our air, and when some large particle enter the throat, we cough and send it out, and when it goes inside, we have first line defense cells in our respiratory tract, and they try to contain, especially not only the respiratory tract, in the air sacs also.
Yes, sir.
One important defense is alveolar macrophages. There are numerous. You maybe as a 12th standard students, you might have heard about white cells, polymorphs, and macrophages. They are all innate immunity. We have inherent immunity even without exposed to any stimulus. We have already a ready-made mechanisms.
Yes, sir.
And they are already there the first line. And these cells, they contain this Mycobacterium tuberculosis bacilli, which entered somebody's lung, and if they are very good immune system the individual has, they contain and they do not allow the organism to multiply.
Yes.
Some of the organism will be killed by this our host defense system. Some of them, this tuberculosis bacilli is unlike other bacteria. They have an ability to survive inside our body without multiplication in dormant state. And this dormancy, dormant means they are quiet, they don't multiply. But same time, so that they are contained by our first line defense mechanism. This dormancy, they stay in these cells within the lung, and also some of them escape and go to the other portion of the body. And every organ has this defense centers. They are security cells.
Yes.
And these macrophages are there in various parts of the body. So this Mycobacterium tuberculosis bacilli, when the individual's immunity is good, they don't multiply, but they stay dormant, docile in our body, in lung and other portion of the body in the macrophages.
Yes.
And this, when the organism enters and stay in our body, we call infection. So before that, I want to tell you two important terms as lay people we should know. What is infection and what is disease? Mycobacterium infection is different from Mycobacterium disease. Infection is mere presence of organism in your body.
Yes, sir.
That is infection. Disease is this organism which is there in your body, but it is affecting that organ function.
Yes.
And it is associated with external manifestation we call disease. So now you will be able to understand that the Mycobacterium tuberculosis bacilli entering somebody's lung, and because of the immunity it is contained and it stays dormant in the body, we call is infected.
Yes, sir.
But if they develop disease due to multiplication multiplication and spread, then with an external manifestation we call tubercular disease.
Yes.
Now you may be wondering, after entering somebody's lung, if the immunity is not good, you will develop disease. It's understood. Now you understand, right? But this disease development depends on the individual's immunity. This can occur immediately after the organism entering your body. This is called primary tubercular disease.
Yes.
This is the future in children less than 5 years, where the body is trying to develop their own immune system, and the immune system is not very strong. They are likely to develop disease immediately organism entering your body. That is called primary tubercular disease. For some of them, because the organism stays dormant, later stage, like for example at the age of 18 or 19, they're joining medical college. First year exams are very tough.
Yes.
They don't take food, they have adequate sleep. Their immune system is altered. You may be knowing nutrition and sleep are very important to have a robust immune system. And typically these college students, when during exam time, they don't sleep. They sleep for a few hours, and erratic food habits and everything make their immunity little bit go down.
Yes.
At that time, the organism which they were exposed in a younger age group,
yes,
which was lying dormant in our system, it starts multiplying.
yes,
This is called reactivation.
yes,
We call this a post-primary tuberculosis. So coming back to your question, latent TB means the individual is exposed to Mycobacterium tubercle bacilli, and the organism is alive inside your body but not multiplying,
yes,
and it has not produced any organ dysfunction. That is latent TB infection. Disease means they have manifestations, and latent TB patients cannot spread disease to others.
Yes.
When they have a disease, and especially lung tubercular disease, because the lung is affected, they have symptoms and they have damage to the lung and the organ is not is disturbed, then we call pulmonary tubercular disease, and these people can spread infection to others. So, but it is important to know about latent TB infection, because if you can treat them early in high risk people, then we can prevent the source of spread.
Yes.
So now I hope you understand. You can ask me if you have. It's not.
Yes.
It's clear to you. Therefore, the audience also will
Yes.
be able to understand.
So how does one know that they have the TB infection, sir? For the disease, they can display signs and symptoms, but for the infection, where this bacterium it is dormant, how does one know that they have this infection?
Yeah. So it is. So now it's a good continuation of this question. So there are two ways. Whenever somebody is infected or exposed to Mycobacterium tubercle bacilli, our immune system is activated. When the immune system is activated, we have a lot of memory cells, immune cells in the body, and they produce a lot of mediators. We have tests to identify whether this individual immune system was exposed to Mycobacterium tubercle bacilli. We have a skin test,
yes,
and we also have a blood test.
Okay.
And that's how you might have heard a TB test. Patients may tell, doctor, we had a TB skin test. And that skin test, if it is positive, it says that the particular person is exposed to Mycobacterium tuberculosis. That's all. It does not say that the individual is suffering from active tubercular disease.
Yes, sir.
So to know latent TB infection, we need to do either a skin test or a specific blood test. There are many blood tests.
Yes,
to make things simple. I have just told you this. There we call TB gamma interferon assay. There are so many commercial names are available. It's a spot test is available. The laboratories are doing, and it is widely available nowadays.
Yes. So what are the risk factors involving TB? Sir, I recently learned that those who have diabetes and those who are HIV positive, TB poses a higher health threat to them. Who else does it pose a threat risk to, sir?
So, in many times, a country like India, many of us are exposed to Mycobacterium tubercle bacilli. By the time you reach 15 or 17 years, in some point of life, you and me would have got exposed. You may be having tubercle bacilli inside you. I am having it, or you also may be having. But because, as I told, 40% of the population, general population, are exposed.
Yes.
If you do a tubercle skin test, they will be positive, but they don't suffer from tubercle disease. What is the chance of you developing an active disease after getting exposed? The chance of myself or you getting a tubercle disease is 5 to 10% over a life period of time.
Yes.
The 5% chance to 5 to 10 or even up to 15% chance we may develop disease at some point of time.
Yes.
But an HIV positive patient, human immunodeficiency virus affected patient, the chance of, because the HIV, you know that the word itself says human immunodeficiency virus, it attacks the individuals, the affected person's immune system in multiple ways.
Yes.
And makes them vulnerable for a myriad of microorganisms, which are even a very simple organism for you and me will produce disease for HIV patients. So there, the chance of them developing an active tubercular disease, can you imagine? 100-fold.
Yes.
They develop the chance of that's 100-fold chance increased risk. They develop around 15 to 20% risk every year, not lifetime. So that's why a government program, this deadly combination of TB and HIV, the DO is very, TB worsens HIV and HIV increases the vulnerability of TB, and it has a lot of impact to the affected individual and to the governments and the society.
Yes.
So one disease where the immunity is very low and the chance of them developing active disease is HIV, and high risk conditions which we need to know who can have increased risk of developing an active disease after getting exposed is kidney disease patients, especially who require dialysis. And for tuberculosis, we have two types of immune mechanism in our body called cell-mediated immunity and antibody-mediated immunity. For tuberculosis, for certain organisms like viruses and intracellular organisms like tuberculosis, the type of immunity which is needed is cell-mediated, which is predominantly affected in HIV, also in kidney disease patients.
Yes, sir.
So they are more vulnerable. And there is one more condition called occupational disease called silicosis. They are more vulnerable because they have macrophage dysfunction.
Yes, sir.
And next is moderate risk is diabetes.
Yes.
Uncontrolled diabetes. When somebody has diabetes which is uncontrolled, they are more chance of developing an active disease. And somebody is on immunosuppressive medications. For example, they would have got transplanted for kidney. To prevent rejection, many of these solid organ transplant patients, they are on lifelong anti-rejection medications.
Yes, sir.
So everything has a side effect. So you don't want rejection, but we have to pay for a side effect is their defense mechanism is impaired.
Yes, sir.
So it is a challenge. That is why many of these transplant patients are periodically asked to take all preventive measures like this mask, many of them will be having, and they would all ask for vaccinations before transplant, like that. And so transplant patients, they are because of anti-rejection medications, they are more vulnerable to develop active tubercular disease. And somebody who's not on transplant, they have autoimmune diseases, collagen vascular diseases, we call rheumatological diseases. For example, they may have connective tissue diseases where your body is producing antibody against our own parts.
Yes.
And these disorders are treated with drugs called corticosteroids, you might have heard. And these corticosteroids also decrease the immunity when they are on prolonged period of corticosteroids tablet forms. It's not inhaled forms or topical forms. It is mainly when they take the tablet forms for longer period at a higher dose, they are more vulnerable to develop tuberculosis. And extremes of age, as I mentioned, infants. For example, mother develops frank pulmonary tuberculosis. A 2-year-old child, less than 5 years, they are more vulnerable.
Yes.
And pregnant women. And elderly people, because they are all again basically their immune system is not very robust.
Yes,
so extremes of age and undernourished people, and very importantly smokers and alcoholics.
Yes,
so these are the people who have increased risk of developing active TB after getting exposed to mycobacterial tuberculosis. Otherwise, if you are fit, even if you are exposed, our immune system will take care, and this organism will stay dormant with us without making noise.
Yes. So what about passive smokers? So those people who are constantly around people who smoke, does TB pose a health threat to them?
Yeah, I may not be able to tell you exactly what is the risk, but definitely passive smoking has an equal, almost comparable risk to an active smoker.
Yes.
The duration is important. So the passive smoking once in a while in a place like this, okay. But imagine a lady married to a smoker, who's living with them for so many years. Definitely it has impact. And the children of parents who smoking, they can develop all complications of smoking. Especially for asthma, recurrent lung infections, and they can develop lung infection, which may be again tuberculosis may be there, and also cancer. So passive smoking is definitely bad.
Yes. So the next thing is related to the vaccination. So most children in India during their childhood, they receive the Bcg vaccination. So does this make one completely safe and risk-free?
A very good question. Especially vaccine has become now so common subject in our country now.
Yes, sir.
Because of thanks to COVID. And we are very happy. Masks and vaccine are big boon to the society after COVID. And BCG is one of the oldest vaccines. And countries with high prevalent, like India is one of the world's large number, the most very high, leading number of country where the tuberculosis patient is in our country. And BCG is definitely, and we play our country played a lot of role in development of BCG. It is very much protective.
Yes.
That's why our country is there and still our national immunization program. This protection is especially in young age group.
Yes.
So when you give in the immediately after birth, when like that, it protects younger children in developing severe form of tuberculosis. Definitely, BCG is very much protective for young age. Then what is the problem with why we had this question? This protection may not be there for
life,
for even they enter the adulthood. It's not a continued protection, but it is very, very important to prevent a severe form of tuberculosis in this age group, like less than 5 years. The tuberculosis can present in a very different way. It's not like lung TB like adult.
Yes.
They can develop tuberculosis of the brain coverings. We call tuberculosis meningitis. They develop disseminated tuberculosis, meaning that multiple organs are involved.
Yes, sir.
So tuberculosis is very serious in infants and young children. So BCG will prevent this, very useful, and that's why in countries where prevalence of tuberculosis is very high endemic areas, tuberculosis BCG vaccine is a must.
Yes, sir. So in recent newspaper articles, I've read that those who have received this TB vaccination were lesser likely to get the COVID-19 virus. And according to US researchers who studied the variation of intensity of this virus all over the world, those who received the BCG vaccination in their childhood had a certain amount of protection against tuberculosis. And as a result, in countries like US, Italy and France, where this vaccination has been discontinued, there has been a higher death toll. Is this true, sir?
Definitely this research was true. No doubt in that, because it's my research are multiple types.
Yes.
Like this is an observational epidemiological research. Definitely they did notice this COVID related mortality was when compared to a country where BCG vaccine is not a routine. Definitely it is there is a role. And like not only that, we also know that the tuberculosis BCG vaccine, they have a non-specific stimulation of immune system. So that definitely it has theoretically, hypothetically, it is true, and we should be happy.
Yes, sir.
For that. But strong evidence, like for example, you take BCG, you will not develop this. That is enough. There were situations before COVID vaccine came. People were talking about the MMR vaccine, and they wanted to have BCG vaccine. Then you have this, you will prevent. Fortunately, the COVID vaccine came earlier, and then people stopped talking less.
Yes.
But yes, it does. There is a definite possibility it is helping, but we need to have more research to be very concrete about this association.
So I've always thought that TB was treated through drugs, sir. But I've also recently heard that there is a surgical treatment available for TB. So how does one treat a bacterial disease through surgery, sir?
Yeah. So I take this opportunity to talk about little bit about the drugs also. So TB is a curable disease. We have a combination of drugs, but the peculiarity of TB treatment is we give for longer time, because if you interrupt the treatment short, they try to, because of the dormant bacilli, they have a relapse of the TB. They come back. So there is few years back, so many years back, a decade before, we used to, because of the medicines are not so effective, we used to give for 1 year to 1.5 years treatment. With the more number of good medications, very effective medications started coming, we could take care of this sleeping bacilli, and therefore we can prevent the relapse. So the duration of treatment has come to 6 months at present, and it is likely to come much shorter in future.
Yes.
So mostly the key armamentarium available for TB treatment is medications, a combination of drugs. And we need to give for whatever be the tuberculosis, any part of the body, the treatment is same, the same medications. Now, the question is role of surgery.
Yes.
Because it is curiosity. It's a very important also to know that. Depends on which organ the tuberculosis affected. There is a role for surgery in TB affecting a certain portion of the skeletal bone TB when there is a collections, there is a pus accumulation and it's compressing the important structures. Yes. It may be removed. And in the lung, there is a role for surgery. If there is, because of the TB, the basal lung tissue damage, if they have uncontrolled bleeding. I had a patient yesterday night has come to my emergency. Yes, who was diagnosed to have tuberculosis in Pollachi the day before. Yes. And yesterday night he has come with spitting blood around 50 to 100 ml almost, and it is life threatening. It can choke the airway. They can have, so this time, like there are methods, like we have a method to block it by embolization. Sometimes we may have to do even remove the portion of affected portion. So in lung tuberculosis, an uncontrolled blood bleeding from the lung because of the tubercular lung damage to the lung tissue, we call a massive hemoptysis. Yes. That is an only indication. And there is a role for surgery in one lung tuberculosis, which is called drug-resistant tuberculosis. Yes, sir. This drug-resistant tuberculosis is a difficult to treat situation, and it's not good for the individual and for the society because, as I told, the drug-sensitive tuberculosis we give for 6 months treatment. Yes, for this drug-resistant pulmonary tuberculosis, we give for much prolonged treatment. We give more number of medications. It is difficult for patients to take it, to tolerate it, and many of them default it. And the cure may not be achieved in many of them. So to reduce the organism burden, we remove a certain portion of the lung. So there is a role for surgery in drug-resistant tuberculosis. But all these situations, it is very, very important that they are also on adequate medical management, which is drugs. Yes. That should be there. It is over and above that, there is a role for surgery. So, without medications, tuberculosis will not be treated. The surgery is needed. It depends on the organ involved and in select situations.
Yes. And finally, I understand that the theme for this year is Invest to End TB and Save Lives. Why has investing in this become a prime need now, sir? Could you explain us about it?
This is basically now, as I told, tuberculosis is an infectious disease. Yes. And the world, its effect on the human race is too large. It is important for us to know throughout the world, around 4,000 people die every day because of tuberculosis. And around 30,000 people are affected by every day with tuberculosis. And every country, like even in developing country, the underdeveloped country or developing nations, everybody is having problem because of this. There is a economic and health impact is too high. And World Health Organization and United Nations, and they with all countries, everybody joined together, and they have a goal called to end TB. Yes. Or a stop TB. The target is around by 2030 to 35. They want to reduce the incidence of new developed TB coming by 90% and TB death by 95%. And for this, they have been working since 2018, and there was a good progress. Yes, sir. Because all this organization with every nations with partnership and NGOs and everybody joined together, they pooled the resources and they devised the strategy. The main strategy is identify the tuberculosis patients early and treat them, especially lung TB. Yes, sir. They focus on lung TB. As I told you, You catch them at the lung TB patients, we can prevent spreading to so many people.
Yes.
So the impact is good. You invest $1, the benefit is quite much larger. So you have to find out. That's how it will work in larger resources. So every government and all World Health Organization, everybody pool the investment for especially for early diagnosis. They developed strategies, the newer tests which are easily accessible to every parts of the country and world, and also availability of medications to all nations through a majority of the world, with irrespective of their economic status, and also to have a follow-up and do research in this area also. For all this, we need fund.
Yes.
And it was full and it was going very well. What happened in 2020 March, COVID came. And once COVID came and all this, we turned our everything.
Yes.
So we started doing only very essential, all COVID related. We started restricting people coming to the hospitals, and also diverting resources for taking care of COVID. Not only manpower, even laboratory.
Yes,
and resources and funds at every level. The small hospital level, institutions level, country level, everywhere. Yes. So ultimately, TB took second this thing.
Place.
So COVID was there, and in 2020 end, they noticed there is an increase in number of deaths due to tuberculosis, which was very alarming. Not only that, the number of TB patients everywhere we are supposed to detect, that number also came down.
Yes, sir.
So as I told you, when you detect less, that means you are going to miss the opportunity for containing.
Yes, sir.
So all this, they are eagerly waiting, and now all stakeholders, especially this theme is meant for the countries and nations, that you step up ramp up your effort against containing. You invest more now again on TB.
Yes,
so it is definitely economic, and it's meant for you need to invest more in fund, and of course we can take it for everybody, and so that we can contain and achieve the goal of eliminating tuberculosis, and by especially a disease which is preventable and curable.
Yes.
So we can prevent it. It is 100% curable. See, there are very few diseases we can say that 100% curable. Tuberculosis is one such, but still we are not able to do it because we have to detect them early.
Yes, sir. So thank you, sir. And with that, we wrap up this conversation. It was a great pleasure meeting you, sir. And thank you so much for taking time from your busy schedule to educate us about this and tell us so much about this, sir. Thank you very much.
Yeah, I think I thank you and NGP school team for this, because exactly for this only we celebrate all these world days of various diseases. We want to spread awareness. And this will save so many lives.
Yes.
And I greatly appreciate for the opportunity for your whole team here. And thank you very much.
Thank you, sir.